Nat, if you guys don't already know.
And
Nat. This time we're going to be talking to you guys about what our favorite things are about the nursing career or about being a nurse. I know there are some people that watch us that are looking into getting into the career, are still like maybe in school.
Not sure too.
Yeah, maybe not sure. Thinking about like, is this the right career for me?
Yeah.
And so we're just here to tell you guys what we love the most about it.
Yeah.
And yeah, maybe this will help you guys decide whether that would fit for you. Or if it's like, yeah, I don't think I would like that. So maybe let me try something else.
Yeah. Which actually, now that you point that out, there was actually a patient's granddaughter that came with the patient. And she was saying, she's like, yeah, I was thinking about being a nurse, but I don't have the patience for it. So didn't do it.
Do you need patience?
Yes.
Yes.
You need lots of patience.
Yes, because at the end of the day, you're dealing with people.
Yeah.
And maybe
sick people too.
Yeah, that's the thing too.
Which is bad.
Sick people. And you know, all I know is when I'm sick, I could be annoying.
Me too.
I could be annoying.
I want water. I want ice.
I want just like cater to me.
I want you to fix my bed.
Yeah, like and I just like to whine.
Whine,
like,
me
I'm
too.
so annoying.
Oh my god, me too.
Right? And so like I wouldn't necessarily be this way in a hospital. I don't think so.
I don't think so. No, I don't think so.
But
I know so. I'm not like that.
I would not. Yeah, I wouldn't do this in a hospital. But maybe if my mind is not correct, maybe I would. Maybe. I don't know. I have not been put in this situation. But the point is, yeah.
You need patience.
Yes. Can some patients be annoying?
Yeah.
Yes.
Do we deal with that?
Yes.
Yeah.
Can some patients be so freaking sweet?
Oh,
and you're like, oh my god, I want to help you. I wish I could help you more. But I have other patients and like, I can't help you more because I'm not going home with you. Like, yes, there are also a lot of those too.
It's so funny because sometimes like it hurts so much how nice they are. I'm like, oh my god, you're so nice.
Yeah, and like sometimes you see like their family come and you're like, oh my god, they're so sweet too. Or maybe they're not so sweet and you're like, oh my god, like how could you
be so nice and then your family member is such a...
Yeah. At the end of the day, we don't really know them. We don't know what they've been through.
That's true.
Just from the experience of knowing them for the moment, maybe for a few days that you're with them, you know, you get a little bit of feel of the person. And, you know, some patients can be a pleasure to work with. Some patients, you can't wait until they leave. So it is what it is.
Yeah. I guess like that's one of the things that I'm like, not that I like, but that I already had, that I feel like I am such a people's person that requires a lot of patience. And so I guess that's one of the things that I like about nursing, is that the fact that it applies to my life. Like, it applies to who I am, kind of, if that makes sense. In some way, like, in some category, like, I feel like I love serving people, and so it gives me, like, a different perspective on life, being able to serve these people. And it just brings me so much joy.
Yeah.
Like, it really does. Like, being able to see... I've had so many... Like, I actually had one patient where... This was during COVID. She was not doing well. She was very kind of, like, trying... Like, they were discussing about intubation, and she didn't want it. She was ready to die. And then, like, 2 weeks later, I thought this woman passed away. I'm not gonna lie. I thought she passed away. I cried for her in the room. I was, like, holding her hand. And then 2 weeks later, she's walking and talking in the room. And I'm like, wow.
Yeah.
I had something to do with that. And it brings me so much joy.
Yeah, it is definitely rewarding in a lot of ways. You know, some people need a purpose in life. I think most people do, I would say.
Yeah, I would say.
Like, feeling like you're giving to the world, I guess, or like whatever. And I think that being a nurse does satisfy that part of your life where like you are making an impact on someone's life. Maybe it's something minimal. Maybe you told them, listen, you gotta drink more water, and the fact that they drank more water and they were like, you know, the nurse told me to do this, and then they do it and their life is better, like they might still remember you forever. And I think that that's one of the best parts about nursing, like you know, being able to help others and just like spreading your knowledge to like a patient that may not know things about the medical field. And you'd be surprised. Like, I thought some people, there was like a common knowledge about like medical, like just like a common like base knowledge, and
but
some people do not know a thing. Like like it's kind of like, you know, you can't like just drink juice all day. You gotta drink water, and they're like, I didn't know that.
Yeah, and you're like,
what?
oh,
Like, I thought that was like just basic knowledge.
Yeah,
like,
but
you know what I mean?
Mm-hmm.
So it is definitely a rewarding career. You know, it also is your own mindset about it. You know, you might not be for you.
Yes, it's very rewarding. And then I know for you specifically, you love how like how many outlets you can go through with nursing. Like there's so many areas you can enter, so many specialties, so many things that you can do.
To that point, yes, that is the reason why I chose nursing. Originally, I wanted to do physician assistant, and that is also a great career.
Yes.
But when I looked into nursing, I saw that there was more avenues I can go with that, and because of the fact that like I can be a nurse practitioner and own my own, even have my own clinic, and basically practice on my own without the supervision of a doctor, in whatever, depends on what state you live in, of course. So I saw that with a nurse, you have opportunity to do different things within the field, grow within a field, grow to be an entrepreneur. Like there's so many avenues, and of course, if you saw the previous video, I'll say it again. Right? I'm gonna repeat it for like the 10th time.
Repeat it every video.
I'm gonna repeat it because maybe you watched this video and you don't watch the previous one.
That's so true.
Which you could still do if you wanted to.
And you can also subscribe to the channel because I mean you're new to this channel. So right there, subscribe.
But my favorite thing is the different things you can do within nursing.
Yeah, that's true.
There's just so many things.
Like there's so much. Like the fact that we did traveling, like we can speak for our own experience, you know, specifically, but like we were in med-surg, then we did traveling, and then we did a little bit of school nursing, then you did a little bit of IV hydration, then we're getting into Botox, then we are still in another part of nursing, like outpatient nursing, because outpatient nursing is a bit different from inpatient nursing. So there's just so many things that like you don't really get bored of nursing because there's just so much you could go. You can wet your feet anywhere you go.
Yeah, and like, you know, there are some jobs that can get like very repetitive.
That's very true.
And like maybe you get bored in it, and for some people maybe they like that, but for nursing there's some, even if you stay within the same unit, you might see a lot of the same patients or same similar patients, but it's always, you at least once a week, you're gonna learn something new. You're gonna learn something new, and you're gonna brush up on those skills or whatever the case may be. And I think that is also very rewarding because your mind continues to grow. Your mind continues to expand. True. And you're not very like is it monotonous? What is monotonous? Monotonous is like repetitive, right?
I think that's what it,
You're not in like that, like same, like, you know, same little thing that you do. But like, you know, it can happen, but it's less likely to happen within the nursing field, and I think that that's great.
I mean, but just look at it, like how when we first started, like we learned so much in the beginning, and then not only just that, now we had the basis of nursing, of how to care for a patient, what to do in specific situations, and it actually becomes a point where it just becomes so quick that you don't even think about certain things. Like it's not processing in your brain what you're doing for your patient when they're sick, right? So now you got that down packed. Now you get into the leadership portion of nursing, which is a charge nurse, and then you're doing you know, you're advocating for your floor, you're advocating for your patients, you're advocating for your nurses. So there's just so much that you can do alone in even one unit.
Yeah.
You know what I mean? Leadership, clinical work. I mean, there's just so much.
There's so much. There is. I think that is true. Like, for example, like where I am right now, it is getting a little repetitive because all I do is give vaccines.
Yeah.
But you know, it's also like a contract. So I'm not gonna be doing that forever.
Yeah.
You know what I mean? So that's why I'm okay with that right now. But I do see that if I were doing this forever, I would not like it because I just feel like I'm not expanding. Like I'm losing some skills. I'm not really like learning new things. I'm just giving vaccine. So I can see how that could be, but again, it's a contract, so I will be moving on to something and learning something new, but it can get repetitive, and I could see how like I could like, maybe not like it. You know what I mean?
But like going to that is like, that's why I decided to do outpatient or like become a staff nurse in this current position that I have, right? So for me, it was more that is the fact that I wanted to learn a lot more about the outpatient clinic nurse. What am I gonna do? How do I care for my patients? How do I advocate for my patients? How do I advocate for myself? You know, certain things that I wanted to learn about. That's why I decided to take this specific position.
Yeah, it is definitely, you know, I never really thought about the outpatient experience, but it does lead up to the inpatient experience.
Yeah,
because
it does.
Outpatient is like how do you manage your health, everyday health, right?
That's
like
very true.
Inpatient, you really just make making the patient stable, but it's what they do after that, how they follow up with their doctor, what they do every day in their home that prevents them from coming back to the hospital. And that's really like the outpatient role.
I mean, I know that, anybody needs to go to the hospital at some point in their life, but now we're trying to prolong that portion of that time that you have to go.
Right.
And so, there's so many things that you can do in the outpatient setting so that your patients can live a more satisfying life and purposeful life for themselves, you know?
Yeah. So it is like, I never ever thought about the outpatient experience or the outpatient nurse and what their role is, but it is very, very important as well. Another thing is that I feel like I can apply what I learn on the job to like my personal life too. Like, even if it's like helping my mother, helping my cousin, whatever, with their disease to prevent them from going, like, I feel like I like the fact that like I am reliable. I like it sometimes.
Not all the time.
Not all the time. Take that back. Sometimes I just want to not be responsible. Nobody send me a picture of their poop right now.
No, I'm trying to be chilling right now.
But it is nice too that like you have the knowledge that you can share.
Share.
And help like your parents that maybe getting a little old. Like, mommy, that sounds like signs of heart failure. You need to go check your heart. You need to go check your heart. Mommy, diabetes.
Yeah, or like when your parents end up going to the hospital, you understand what's actually going on and how to manage that, like how to manage them later on or even during the moment, So like my mom constantly messages me like, hey, is this a good blood pressure, about random people in the family that I don't even know. And I'm like, yeah, that's a good blood pressure, just keep an eye on it, whatever. And I even ask Ange like, yo, this is good, right? Like in the outpatient setting, like it's good, right? Because sometimes like I forget about outpatient and inpatient. Like inpatient, a blood pressure of like 140, 150 is good, but maybe in the outpatient setting it's not that good.
Like, ooh, why is it high? You know, it's kind of hard when you don't know the whole patient's like history. That's one thing that I tell my family. Like, hey, I can't tell you what you have over the phone. Like, I don't have an X-ray. I don't have a CT. I don't know. I don't have your record. Like, I'm also not like I cannot medically diagnose you. Like, I could tell you like what could maybe be going on, or like if triage pretty much. Yeah. But I do love the fact that like I can help my family and my close friends. Yeah. I like the fact that like what I learn on my day-to-day job applies to my real life. Like my real life outside of work.
And then like adding to that, for me, the way it applies to my life is pretty much developing myself and like for me to be stronger for myself. Is that what it is?
Like bettering
myself, like self-development. Like I'm into a lot, like I mentioned this before, but I'm so into like exercising, journaling, meditating, going to therapy, going for walks. Like I enjoy life so much more, I feel, than I did before. Like before it was about school, getting A's, getting this, getting that. Now I'm able to put my life into purpose and into a different perspective. And I just enjoy that about nursing. And I think that's the only, because of nursing, I have been able to do that. I have been able to determine what are things that are important in my life. And it's my friends, my family. Everything else comes second. You know what I mean?
Yeah, and your health.
And my health
too, everything,
like for me, the importance is my friends and family. How can I be here longer? Okay, exercising, eating healthier, drinking more water. I don't know, I said water. Which, guys, this is Stanley Starbucks collab. I've been drinking this cup, and drinking water out of this cup.
I'm like, what? You've been drinking the cup?
I've been drinking the cup. I've been drinking water out of this cup this whole time, and I have not introduced my cute little cup. And guess who got it for me for my birthday? My friends.
I was searching for this thing. I found it.
When I got it, I was like, oh my god.
Who's a cup lover here? Because I didn't know that was a thing.
Yeah, it's a thing.
But it's a thing. People just love Starbucks cups.
Sorry.
I just like people literally like buy like I don't think yours is like
no, it's not that bad.
Like, some people are obsessed. Like you need a budget. Put yourself on a budget. That's
wild.
I didn't know that. Good marketing, Starbucks.
Yeah, good. And Stanley too. This is so cute.
Yeah, Stanley too, because what's the obsession with Stanley? Like, it's just so big.
This is such a cute little cup. Like, it's not as big as the original Stanley's. And like, it's pink. It's cute. Like, I love it. I'm going to Dominican Republic, and this is going with me in my bag because this is so cute. This is how cute.
Yeah, it's not as big as the other ones. I don't know what the huge deal with the nurses are with the big Stanley cups. Cause you can't even have that. I know you guys can't have that on your unit.
If Jaco sees it,
you're done.
Yeah, ding.
Or at least the unit is. But guys, we are very happy that we chose this field. We may not be happy with everything within it.
And that's okay.
Because that's okay.
That's fine. That's life.
Exactly. Life. But when people ask me, do you recommend
nursing?
Nursing, I will say
it depends.
It depends if that's for you.
And we talk about if that's really for you.
Yeah, because some people do it because, that's another pro.
Money.
I feel like at least in New York City, you do start off pretty well. I would say, like, it's not... Although with inflation now, we need more, but it's a good start.
It's a good start.
It's a great start.
I need to go more though. But yeah, it's a good start. You know what I mean? So money is good, but you shouldn't get into this field for money.
For money, no, because you could tell some of the nurses that are in it. You could tell.
Yeah, and you're gonna be caring for patients, literally. Yeah. Like your energy matters.
Yeah,
you know?
yeah.
So if you're negative and you're like,
yeah.
Patients feel that.
Yeah.
You know?
It is a pro that you're making well. Like, I'm not gonna lie and say that when I looked up nursing, I didn't look up the salary. I did. Of course I did, because at the end of the day, I need to be compensated. Like, I have a life that I want to live, and I need to fund that life.
Yeah.
And nursing did put me in a really, really, really good position to fund that life that I currently live now. And I am grateful.
I'm so grateful.
So that is also another thing we love about being nurses. Yeah. What are some things you guys love about being nurses? Maybe we're not thinking about everything.
What are you guys looking forward to nursing? Yeah,
like what do you want out of the career?
Yes.
What I want out of the career is fulfillment, being fulfilled. And being able to fund my lifestyle too. That's important for me. Yeah. And I think fulfillment and something rewarding, something that I can constantly learn is what I look for. Yeah. And that's what I have.
And that is what we have here in nursing. Yeah, because once you get bored of one specialty, you can move on to the next.
Yeah, exactly.
And we like
that is good about being a nurse.
I love that for us.
And we can continue to grow. Like, we could be nurse practitioners.
Yes.
We could be
educators, we could be leaders, we could be charge nurses, we could be clinical nurses if we want to stay here. We can be OR nurses. We can be so much. The possibilities are endless.
They are.
That's what we like.
But let us know what you guys like the most about being nurses, or hope to get to when you are a nurse.
Yeah, that was the question that I had earlier.
Yeah, exactly.
Couldn't word
what do you want out of the career? And I hope you get that. Yeah. And I hope you, and I know you guys are, but you also is what you think, your mentality about it. Again, that's always the case.
That's always the case in everything in life. It's your mentality about the thing.
Yeah. But let us know what you guys think, and we will see you next time.
Bye guys. Thanks for watching.
Bye.